And Senator Mark Warner hears stories from constituents like Lynette, Liz, and Lindsay.
Like, I went where you told me I had to go. It seems really unethical.
And I'm just a person stuck in the middle.
He says he can relate to their surprise and anger about receiving an unexpected medical bill.
I'm fighting it tooth and nail.
Senator Warner typically shields his family from the public eye, but this issue was so important to him, he wanted to speak out.
My eldest daughter, who's got another number of health issues, and we have good health insurance.
And yet, after his family took her to have an emergency procedure done at a Northern Virginia hospital in network with their insurance, they received a surprise bill.
And lo and behold, we end up getting, I originally thought it was one number, but it was, my wife told me it was actually a $198,000 bill.
Senator Warner says just like the women we profiled, the bill resulted from something called balance billing, when a doctor that is not in your network provides care at a hospital that is in your network, leaving you to cover the out-of-network amount your insurance did not pay for.
We said, hey, we have health insurance. We use this hospital all the time. This should be covered.
The senator says he has no intention of paying the bill, and others shouldn't either.
If you get these surprise bills, you should try to fight them.
So what can the average person do when it comes to trying to fight these bills?
I think you need to basically say to the insurance company, no, I pay for this insurance.
Warner says Congress recognizes that folks need to stop getting these surprise bills.
The good news is there is general agreement. It's not breaking down on a partisan basis, that the customer, the consumer, if they receive one of these surprise bills, should not be liable.
He says 2 bills are under consideration right now that would stop patients from getting balance bills. The first would force doctors to accept an average set price for a particular procedure. Insurers say this is necessary to prevent your insurance premiums from rising because some doctors, they say, charge far too much. For example, let's say you went to the ER in the middle of the night because your child hit their head and ended up with a huge gash. Under this bill, your insurer would pay the doctor that stitched up your child the average negotiated rate for that procedure and post-operation care in your area. But doctors say those rates are often 5 times lower than the retail rate for a procedure. They argue that bill would be unfair to them and make them accept wholesale rates for specialized services. So they support what they call a compromise bill that would allow the doctors to challenge that average price through arbitration.
What I would pick would be, not unlike many times, a compromise. There ought to be an average price, and if there are extraordinary circumstances, there ought to be a narrow exemption for a certain amount of arbitration. But so far, reasonable people have not been able to come to that conclusion.
Further complicating the issue, some say, are provider staffing companies. Senator Warner claims they are taking advantage of the problem by hiring doctors and staffing them at hospitals where they are out of network.
And they come in and try to, frankly, gouge patients.
Do you believe that what these doctors are asking for is fair compensation, or do you think they're just trying to make a buck?
I think there are certain cases where certain groups of doctors, oftentimes driven by Wall Street investors, are coming in and charging whatever the market can bear, and that's not fair.
Now, to that point, I've spoken with several ER doctors who tell me they have no choice but to work for these staffing companies who have contracts with the hospitals. They say that's where most of the jobs are for ER docs. Senator Warner says he is hopeful that the issue will be resolved by the end of the year. Working for you, I'm Melissa Hippolyte for CBS 6.